Hello everyone. Today we will discuss about the pharmacokinetics of the antibiotics. Pharmacokinetics is abbreviated as PK. It is the branch of the pharmacology that studies how the body interacts with the administered drugs throughout the entire duration of the exposure. It involves four main processes. Firstly, absorption. Absorption study how the drug enters into the bloodstream. Secondly, it is called distribution. Distribution is the process by which the drug goes throughout the fluids and tissues of the body. Another process is called the metabolisms. It is the process by which these absorbed drugs break down in the body. Lastly, it is called excretion. It is the process by which the drug leaves the body or how the drug leaves the body. In this presentation, we will discuss mainly about the absorption. There are several factors influence the absorption of the drugs. The first point is the physiological properties of the drugs, which is lipid soluble or water soluble. This solubility of the drugs determine the absorption efficiency. Lipid soluble antibiotics like metronidazoles are better absorbed compared to the water soluble antibiotics like aminoglycosides and glycopeptides oral form. Regarding the administration of the antibiotics, oral and parenteral routes are the most common. Here we need to talk about the bioavailability first. Bioavailability refers to the fraction or the percentage of a drug that reaches the systemic circulation after the administration of the drugs. IV administration is 100% bioavailable, and peak plasma drug levels will be highest after bolus administration. It is because the infusion duration is too short for significant distribution. That is why rapid IV administration is often chosen for antimicrobial therapy in the patients with severe infections in order to reach the drug concentration to the target site rapidly. However, bolus injection is not always appropriate to administer. For example, rapid infusion of the vancomycin can cause red man syndrome. Additionally, bolus injection contains a relatively higher concentration of the drug compared to the infusion, which can irritate the vein and the phlebitis. The bioavailability of the oral administration varies by the drugs. Some drugs, like the fluoroquinolone, metronidazole, and tetracycline, have very good bioavailability similar to their IV formulations. On the other hand, other drugs such as the penicillin G and cefixime, they have poor bioavailability in oral form. Understanding the bioavailability helps you in choosing not only the appropriate antibiotics but also the optimal route of administration. Generally, drugs are better absorbed in the small intestine due to its larger surface area compared to the stomach. Therefore, faster stomach emptying results in earlier and higher plasma drug concentrations. Food, especially the fatty food, delays the gastric emptying, delaying and lowering peak plasma levels, and that may reduce the drug's bioavailability. How about the less absorption? It is advisable to take the penicillin G and azithromycin 30 minutes before food or 2 hours after food because their absorption interferes with food. However, this recommendation can vary depending on the type of the antibiotics. For example, fluoroquinolones, metronidazole, amoxicillin, doxycycline, linezolid, and cotrimoxazole, they not interfere with food. Some drugs with originally low bioavailability have their absorption enhanced by food intake, such as esterified cephalosporins, which so that that cephalosporin becomes more lipophilic. Because these prodrugs are hydrolyzed after intestinal absorption by esterase enzymes in the intestinal epithelium to their active metabolites. As another factors, which is the drug-to-drug interaction, antibiotic absorption can be influenced by co-administration with other medications. Antibiotics like tetracyclines and fluoroquinolones have reduced absorption if taken together with antacids containing calcium, aluminum, and magnesium because these substances chelate the antibiotics and reduce their intestinal absorption. Gastrointestinal absorption can also be affected by ileus colitis, bowel ischemia, and variation in gastric pH. These conditions frequently coexist in case of sepsis. Therefore, IV antibiotics should be administered for the sepsis patients. So this is about the absorption. When understanding the drug absorption help us in selecting the most appropriate route of administration and also minimizing adverse effects like infusion syndrome. In next video, we will discuss about the distribution. And thank you for watching for this presentation.